Sindhigi Shantvereshwara Ayurvedic Medical College and Hospital, Haveri, Department of Panchakarma. This presentation is guided by Dr. Sangamesh Todgoda Sir, HOD of Department of Panchakarma, SSAMC Haveri, and Dr. Rahina Ma'am, Assistant Professor, Department of Panchakarma, SSAMC Haveri. Samsarjana Krama, a critical dietary protocol in Ayurveda, presented by Sriraksha KS, final year. Overview. This PPT consists of introduction, importance, mode of conduction, types of Samsarjana Karma based on food, quantity of dosha eliminated, dominance of dosha, dosha anusara Samsarjana Karma, Peyadi Samsarjana Karma. Properties of Peya, properties of Vilepi, properties of Yusha, properties of Mamsarasa, Peyadi Samsarjana Karma diet chart, Tarpanadi Samsarjana Karma, nature of Tarpanadi Karma, Rasadi Samsarjana Karma, Mamsarasa, Samsarjana Karma based on types of Shuddhi, Roganusara Samsarjana Karma which includes Prameha, Raktapitta, Pandu, Udara, Atisara. Conclusion, discussion and reference. Introduction. Samsarjana Karma in Ayurveda is a sequential dietary regimen followed after Shodhana therapies to restore Agni and overall health. Atha Kalvantaram Vaidyaha Samshuddham Vamana Adibihi Durbalam Krusha Alpagnim Mukta Sandana Bandhanam Nirhatam Anila Vindmotra Kafapittam Krusha Ashayam. A person after purification therapies like Vamana and Virechana becomes Durbala, Krisha, has Alpagni, Mukta Sandana Bandhanam. Emptiness of Ashaya due to expulsion of Vata, Pitta, Kapha, Mala, Mutra is observed. Gradual reintroduction of food after Shodhana to rekindle Agni. Emphasize diet starting with Manda and ending with Mamsarasa. Samsarjana Krama is essential to avoid adverse effects post purification. Importance. Yata Anuragni Struna Gomayadai Sandukshayamane Bhavati Karmane Mahan Stiraha Sarva Pachastaiva Shuddhasya Peyadibir Antaragnihi. As a small sparkle of fire gets handled into a big and stable flame when gradually provided with dry grass, cow dung, etc. Similarly, Agni in a purified person becomes strong and stable, capable of digesting all types of food by sequential administration of Peya, etc. Mode of conduction. Types of Shuddhi, that is body cleansing. Samsarjana Krama is dependent on type of cleansing. There are three types of Shuddhi. Pravara Shuddhi means maximum cleansing, which is done when there is large quantity of morbid doshas in the body, hence 3 Annakala is followed. Madhyama Shuddhi means moderate cleansing, which is performed when there is moderate amount of dosha aggravation in the body, hence 2 Annakala is followed. Hina or Avara Shuddhi means cleansing of body in small quantity when doshas are aggravated in smaller quantities. Hence, 1 Annakala is followed. Types of Samsarjana Krama based on food. Peyadi Krama, Tarpanadi Krama, Rasa Samsarjana Krama, Mamsa Rasadi Krama. Based on quantity of dosha eliminated. 1 Prastha, Avara Shuddhi, 1 Annakala is followed. Half Adaka, Madhyama Shuddhi, 2 Annakala is followed. 1 Adaka, Uttama Shuddhi, 3 Annakala is followed. Based on dominance of dosha, Vata dominance, Pitta dominance and Kapha dominance. Doshanusara Samsarjana Krama. Vata Pitta Kaphanam Cha Yatasvam Balavardhanam Samsarjanam Samacharet Doshanusaraha Kramat. Vata dominance focus on consuming uncutaneous, warm and nourishing gruels. Pitta dominance avoid spicy and sour food and opt for Madura and Shitala preparation. Kapha dominance begin with Lagu, Ushna and Tikta or Katurasa preparations. Peyadi Samsarjana Krama Peyam Vilepim Krutam Krutam Cha Yusham Rasam Trividaschaiva Kramena Sevate Vishuddha Kayaha Pradana Madhya Avara Shuddhi Shuddhaha. After the body is cleansed of the morbidities, the patient should be given as food Peya, Vilepi, Akruta as well as Kruta Yusha and Akruta as well as Kruta Rasa. Each of these dietary items should be given for 3 or 2 or 1 meal times to the person whose body is cleansed in accordance with their either Pradhana, Madhyama and Avara cleansing. Properties of Peya. Svedadi Janni Lagavi Deepani Bastani Shodani Shutrishama Glani Hari Peya Vatanulomani. Light and nourishing, balances Vata dosha, removes toxins and supports cleansing of urinary and digestive system, improves digestion and appetite. Properties of Vilepi. Tarpani Vrumhani Vrudya Madura Pittanashani. Satiating, good for heart, sweet assimilation, it helps to pacify the balance of Pitta dosha. Properties of Yusha. Mudga Masha Kalayadai Shimbi Danyai Kruto Yusha Swado Shitala Vatagnaha Patya Sneha Vivajitaha. Light and nourishing, balances Vata dosha, removes toxic and supports cleansing of urinary and digestive system, improves digestion and appetite. Properties of Mamsarasa. Mamsarasaha Sarvabhutanam Balavardhanaha Hitaha Brahmano Marutagnaya Shoshekshina Cha Rogini. It is beneficial to all living organisms and provides strength by nourishing the body. It pacifies Vata dosha which causes degeneration of body. Beneficial in emaciated as a part of regeneration therapy. Peyadi Samsarjana Krama diet chart. Peya is thin rice gruel, rice water with minimal or no fat, watery in consistency, light food to rekindle Agni. Vilepi is semi-thick rice gruel, slightly thick rice cooked, semi-solid in consistency, easy to digest and nourishing. Akruta Yusha is fatless lentil soup, dal with no ghee or spices, liquid in consistency, provides protein and maintains lightness. Kruta Yusha is fat added lentil soup, dal soup with a little amount of ghee. Slightly thicker in consistency, it increases the heaviness. Akruta Mamsarasa, fatless meat soup, thin meat broth with no fat, liquid in consistency, nourishing and strength promoting. Odana plus Yusha or Manda, soft solid food, meat soup, thicker in consistency, builds strength and gradually heavier. Tarpanadi Samsarjana Krama. Kapha Pitte Vishuddhe Alpam Madhyape Vata Pittike. Tarpanadi Kramam Kuryat Peya Abhishyanda Tan. Charaka advised to follow Tarpanadi Krama as Samsarjana Krama in these conditions. When Kapha and Pitta are eliminated in smaller quantity during Samshodhana. In alcoholic subjects, the patients having Vata, Pitta, Prakruti. This is preferred against Peyadi Samsarjana course. Nature of Tarpanadi Krama. Tarpanadi Krame Cha Peyayah Sthane Swachha Tarpanam Vilepiyah Sthane Cha Gana Tarpanam Deyam. According to Chakrapani, Swachha Tarpana can be served instead of Peya and Gana Tarpana instead of Vilepi. Due to similarities, Mugdha Yusha and Mamsarasa can be given as Tarpana, but commentators of Vagbhata mentioned that diet regimen clearly pertaining to Annakala. प्रथमे अन्नकाले लाजा सक्तुवो द्वितीये अन्नकाले मांसरसौदनमित्यशे तर्पणादि क्रमस्तैषां हितः. According to Arunadatta, on first Annakala, Laja plus Shakti should be given. On second Annakala, Jirana Salana Odana should be given. On third Annakala, Mamsarasa plus Odana should be given. According to Parameshwara, on first Annakala, Laja plus Saktu should be given. On second Annakala, Yusha plus Anna Bojana should be given. And on third Annakala, Mamsarasa plus Anna should be given. Rasadi Samsarjana Krama Agni Sandukshanartham Tu Purvam Peyadinam Bishak Rasottarena Upacharet Karmani Karmakovidaha. Snigdha Amla Madurarasa is given in for Pakvashayastha Vata Prashamana. Amla Lavana is given for Agni Sandukshanartham. Madura plus Tikta is given for Pitta Prashamanartham. Kashaya and Katurasa is given for Amashaya Kapha Prashamanartham. Rasadi Samsarjana Krama according to Acharya Charaka and Shushruta. Acharya Charaka says Snigdha Amla Madura Rasa should be given, whereas Shushruta Snigdha Madura Rasa and Tikta should be given. Amla and Lavana according to Charaka, Amla Lavana Kashaya and Snigdha according to Shushruta. Madura Tikta according to Charaka, Madura Amla Lavana according to Shushruta. Kashaya and Katurasa according to Charaka, Snigdha Ruksha alternatively according to Shushruta. Mamsa Rasa Rase Sadhyam Jalam Deyam Mamsam Siddhati Yavata Palastakam Jale Praste Gane Ata Madhyame Tu Shat Mamsasya Vatanam Kuryat Kudavam Tanuke Rase. The ratio of meat and water should be 1:2 for Gana Mamsarasa, should be 1:2.6 for Madhyama Mamsarasa and 1:4 for Tanu Mamsarasa. Samsarjana Krama based on type of Shuddhi. For Pravara Shuddhi, 3 Annakala should be followed, each of Peya, Vilepi, Akrutayusha, Krutayusha and Mamsarasa, followed by normal diet. For Madhyama Shuddhi, 2 Annakala of each Peya, Vilepi, Akrutayusha, Krutayusha, Mamsarasa, followed by normal diet. For Avara Shuddhi, 1 Annakala of each Peya, Vilepi, Akrutayusha, Krutayusha, Mamsarasa of Lava, Harina and then followed by normal diet. Roganusara Samsarjana Krama. Roganusara Samsarjana Krama ensures safe recovery and digestive restoration. Diet must align with dosha, agni and disease stage. Customization is key in Ayurvedic dietary management. Prameha Diabetes mellitus. Avoid sugar and starch-rich foods. Use barley preparations, mudga yusha and takra. Bitter vegetables like bitter gourd, etc. should be used. Rakta Pitta, bleeding disorders. Use cooling and sweet foods, shali rice, manda, milk, sugarcane juice, etc. Avoid pungent, salty and sour items. Gradual introduction of nourishing foods after bleeding control. Pandu. Anemia. Start with light yusha, then add meat soups, iron-rich vegetables. Use draksha and amalaki for rasayana effect. Avoid heavy-to-digest foods initially. Udara. Ascites. Initial phase, a very light diet like manda yusha should be given. Include lekana foods like takra and barley. Avoid salt, heavy and fluid-retaining foods. Atisara, diarrhea. Start with light binding foods, shali rice, peya, bilva yusha, etc. Takra with nutmeg or pomegranate juice. Avoid milk, oily and fermented items. Conclusion. Samsarjana Krama is not merely a post-treatment dietary plan but a vital component of the Panchakarma process, directly impacting the success of Shodhana therapies. By carefully managing the reintroduction of food, it addresses the weakened digestive capacity, Agnimandya, resulting from Shodhana and helps in the regeneration of tissues. The sequential approach, moving from easily digestible to more complex foods, ensures a smooth transition back to a regular diet, maximizing the benefits of the purification process. Discussion. Importance of Agni. Samsarjana Krama emphasizes the restoration of Agni as a key factor for overall health. A weakened Agni can lead to various digestive and metabolic issues. Gradual reintroduction of foods. The progressive introduction of different types of foods, from thin grills to more subsequential preparations like yusha and mamsarasa, is designed to gradually challenge the digestive system, allowing it to adapt and regain its full function. Consideration of individual needs. While the core principles of Samsarjana Krama remain consistent, the specific food choices and duration of each stage can be tailored based on individual needs, considering factors like the type of shodhana performed, the patient's constitution, that is prakriti, and the nature of the disease, vyadhi. Preventing complications. The careful selection and sequence of food in the Samsarjana Krama help to prevent potential complications arising from the sudden introduction of heavy or incompatible diet after Shodhana. Holistic approach. Samsarjana Krama is an integral part of the holistic approach of Ayurveda, recognizing the interconnectedness of the digestive system, tissue health, and overall well being. Beyond diet. While primarily a dietary protocol, Samsarjana Krama also involves mental and emotional aspects of recovery as the patient gradually returns to a sense of normalcy and well being. References. References used in making this presentation are Charaka Samhita, Shushruta Samhita, Ashtanga Hridaya, Kashyapa Samhita, Sharangadhara Samhita, Journal of Ayurveda and Integrated Medical Science, Journal of Natural and Ayurvedic Medicine. Thank you.